Well, thank you. You know, regardless of what you think about the implementation and some of the detail of the Affordable Care Act, I don't think anybody can argue that we absolutely need to drive down the cost of health care. We need to increase the number of insureds, which this clearly does. We need to move people from seeking routine medical care in emergency rooms and get them to clinics. And we need to make sure that those who need more intensive types of care certainly have the resources to do that. I'm not unmindful of the cost issue here, but I think it's an important issue that we need to solve, and I think in our efforts to drive down the, Mr. Chairman, drive down the cost of health care, we need to find this money, and we need to do it now. This is certainly a step in the right direction, Mr. Chair. I'll be supporting the great senator from Los Angeles County in his efforts here. Thank you, sir.
Thank you very much. Any other questions or comments from any of the members? Senator Wynn?
Just comments, no questions. I want to thank Senator Laura for bringing this forward. You know, and thank you for giving me this opportunity just to make a few comments. You know, I've always, for years, dedicated great efforts to provide preventive care in my district. As a former county supervisor, I've hosted various health expos that provides free dental, visions, and Medicare for those who are uninsured or underinsured. Especially when Medi-Cal did away with dental and visions for adults, seniors, and et cetera. So those areas have always been very, very popular at my clinics. And as many of you know, our healthcare system has many deficiencies, and many of our current members struggle to secure appointments for care. Simply put, we do not have enough medical doctors, we don't have enough dentists, we don't have enough specialists willing to accept Medi-Cal payments. And even in this committee, through our chair, we've hosted many informational hearings talking about providers, talking about how we expand it, how we can include more, talking about bringing, you know, whether that is increasing the rates, how do we keep some of our medical students who finish schools here, does residency here, asking them to stay in California to practice versus going out of state. So we have you know, issues with coverage. Unfortunately, we have a system right now that our seniors have to wait until a dental issue becomes so severe that it requires an extraction, because currently preventive dental care for seniors are not covered under Medi-Cal. You know, and so, you know, so I understand the importance of preventive care, but I also have concerns about the sustainability of our public health care system. You know, today there are not enough medical providers in the system to serve the current 12+ million people. Additionally, California will see an increase of 3 to 4 million people, approximately, to the system this year alone. The question then becomes, what happens when we add millions of more members into a system that is already struggling to serve its current members? This bill would also have expenditures that's unknown to state costs that will potentially exceed over $1 billion to general fund. You know, why I appreciate the authors, you know, making some of the changes and seeking for federal waiver. What if we don't get that waiver? Where would the money come from? And how do we continue to provide the service that we've cut services under Medi-Cal in the past to our seniors and to the current members, to where we will be adding more people in. So I'm open to the discussion of access for healthcare to all, because I'm a firm believer in preventive healthcare. However, I think the state needs to be able to pay for it and take care of the current enrollees while we look at ways to bring in more enrollees into the system. And so, thank you, Mr. Chairman.
Thank you. I believe Senator Wolk had a comment or question.
I do. This is a very important bill, and I know how much you have been, you have a passion for this issue, and it's a worthy passion. I too served on a board of supervisors, and for years we struggled with the fact that we knew that the economics of this were unequivocal, that providing health care in the long run would reduce the extraordinary expenses that we had from emergency rooms from people who were sicker because they didn't have access to preventive care or physicians, which those tremendous witnesses and very brave witnesses told us about. I'd like to be a co-author on this bill. I'd like to move the bill if it hasn't been moved. And I certainly hope this is the year for beginning to do what we should do in this country, and that is to ensure every single person, frankly, that steps in its borders. So thank you for that.
Thank you. We have a motion by Senator Wolk. Seeing no other questions, I have some comments I'd like to make. First of all, I'd like to take this opportunity to thank Senator Lara for continuing to bring back this issue. As Senator Wolk said, it's a passion of his, and I commend him, and I think he's done an incredible job not only in this issue, but as a leader in issues related to immigrants as a whole. I too believe that California, as what Senator Lara said, has taken a huge role in the implementation of the Affordable Care Act, and I think this is what we need to do, is to take that next step, to take a leadership role to make sure that everyone is covered, and everyone not only is covered, but more importantly, has access to health care. You know, that's why we're looking at increasing the rates, why I'm carrying that bill. That's why we're having that conversation. That's why we're talking about capacity, about workforce, about distribution problems in the rural and the inner city. So everyone should have access. And I honestly and truly believe that everyone who is in this country, immigrants who are here because they want to live the American dream, they want to work, they want to be productive citizens, they want to pay taxes, they want to give back to the state that they live in, and they deserve all the rights and privileges that are afforded them, and they deserve to have access to quality health care. So I definitely am going to be supporting the bill. I also would like to be added on as a co-author. And as you know, Senator Lara, I hardly ever co-author bills. Right, but this is special, so I will be added as a co-author. So we do have a motion by Senator Wolk. Senator Lara, would you like to close?
Absolutely. I want to just briefly respond to my good colleagues' statements from Orange County. You know, the same coalition that is made up to support this bill is the same coalition that's working to increase our reimbursement rates. It is the same coalition that's working to increase residency slots. And it is the same group that's working to provide health coverage for our undocumented Californians. The fact that it is over $1 billion in terms of cost is not accurate. We know that it's between 400 to 800 million, and that is people that are much smarter than me putting the numbers together. We know that we are already spending $1.2 billion for this population on limited scope care. And 690 million of that is a direct hit to the general fund every year. And so we're in the ballpark. We know that the president's DACA and DAPA have cut this population by half and have cut the cost by half as well. And so that was a very transformative change that happened at the federal level. And we know that of the 2 million undocumented folks, 30% of those can actually afford to pay into a health exchange without any federal or state subsidies. And so the fact is that we're going to add additional folks that can actually contribute to the health exchange program is something that's actually positive, because you want as many enrollees as possible in there. And so we're going to continue to work on this issue. This is a very, very complex issue, and I know, but we are the federal actions and the recent developments when it comes to these executive actions have really helped us in terms of cutting the cost of this bill. We know that this also depends on the enrollment. We know we're not going to have 100% enrollment, so that actually takes another hit in terms of cost containment. And so, you know, we continue to work. And we know this isn't the fiscal committee, but I know many members have asked questions about the cost. And so I wanted to take this moment to kind of talk and address about that. But Senator Nguyen, I completely agree with you. We need to make sure that we increase our reimbursement rates, because there's no point of having a medical program if you don't have doctors that are serving this population. But, you know, we're visionaries in California. We can multitask. We can get this done at the same time. And I'll let you know, what sets us apart from other states is that we can get this done. And and you've heard the stories today, and, we have the similar backgrounds and could probably share multiple stories about our own family members. And so I know it's something that you really care about. And so, I look forward to continuing to have this dialogue. I would ask for you to support this bill today, allow us to continue having this dialogue, and to give the people that are here and that are throughout, the millions that are throughout California toiling and working to make our life better, give them an opportunity to just have the basic human right to access to affordable health care. I respectfully ask for your aye vote.
Thank you. We have item number 1, SB 4, Laura Dupass 2 appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Nielsen. Pan. Roth.
Aye.
Roth, aye. Wolk. Wolk, aye.
Currently has 3. We're going to place that bill on call.
Thank you, Mr. Chair and members.
Thank you. We're going to now move on to item number 2, SB 24, Hill, electronic cigarettes licensing and restrictions. Good afternoon, Senator.
Good afternoon,
Welcome.
Mr. Chair. Thank you.
Please present.
Thank you. I would like to accept the recommended amendments to make my bill consistent with Senator Hernandez SB 151, which increases the minimum age to purchase or consume tobacco from 18 to 21. The amendments make certain that change also applies to e-cigarettes. Last week, this committee voted to pass out Senator Leno's SB 140, which would define electronic cigarettes as tobacco. I share Senator Leno's concerns about the potential harm of e-cigarettes, especially the increase of their use by children. And that's why I introduced SB 24 on the very first day of the legislative session. My bill differs only slightly from Senator Leno's bill, the only difference being my bill retains the existing definition of an e-cigarette that was supported by multiple health groups when it was put into state law in 2010 and is in state law today. Let me tell you what else my bill does. It makes e-cigarette retailers subject to the STAKE Act, California's premier law to prevent youth access to cigarettes and other tobacco products. The STAKE Act has decreased illegal tobacco sales to minors in California from a rate of 37% in 1995 to 8.7% in 2012. By including e-cigarettes in the STAKE Act, the Department of Public Health will be able to conduct stings on e-cigarette retailers using youth decoys to catch retailers selling to minors. Retailers who are caught selling e-cigarettes to minors will be subject to the STAKE Act penalties, including fines, licensure suspension, and/or revocation. SB 24 also requires retail licenses through the Board of Equalization for e-cigarette retailers, which means the state has an enforcement mechanism if a retailer is caught selling to a minor. The retailer's license can be suspended or revoked. SB 24 also includes e-cigarettes in California's Smoke-Free Act, which means that e-cigarettes cannot be used at places of work, schools, daycares, restaurants, bars, hospitals, and on public transportation. The bill also requires that e-cigarette liquids be equipped with child-proof packaging. This is important because more and more kids are getting poisoned by e-cigarette liquids. Children can easily open and ingest the often fruit-flavored e-cigarette liquids, which can be toxic even if ingested in small amounts. Just 1 teaspoon of liquid nicotine can be deadly. In 2012, there were 28 calls to the California Poison Control System for liquid nicotine poisoning, 28 calls in 2012. Last year, there were 243 calls. At least 60% of the calls were for children 5 years old or younger. Finally, the bill allows local preemption. If local governments want to regulate e-cigarettes more strictly, they are free to do so under SB 24. You will hear from health advocacy groups today who are in opposition to my bill. They want my bill to define e-cigarettes as a tobacco product. That is a separate policy debate for a separate bill. I'm focusing on youth prevention and vaping in public places because I've been working on tobacco reform since 1994, when as mayor of the city of San Mateo, I authored one of the first state's anti-smoking ordinances. In 2012, my Assembly Bill 1301 was signed into law, requiring the state to suspend and revoke a store's tobacco license if it repeatedly sells tobacco products to minors. SB 24 uses the existing e-cigarette definition that was established by the legislature in 2010. It says an electronic cigarette is a device that can provide an inhalable dose of nicotine by delivering a vaporized solution. When that definition was put into law, it was not opposed by any health advocates. In fact, several health advocacy organizations supported the definition. The health groups opposing SB 24 think the bill is a step backwards in regulating e-cigarettes. This argument is false and frankly misleading because it's based on the health groups' national campaign efforts to regulate electronic cigarettes. As legislators, we have no obligation to achieve their campaign goals. Our obligation is to protect the health of our constituents in California, and I ask that you consider whether each provision in my bill is an improvement over current law. There's no debate that SB 24 improves the way we regulate e-cigarettes to prevent youth vaping and protect public health. There are a number of tobacco control bills in the legislature this year, including my bill, Senator Leno's on electronic cigarettes. At the end of the day, no one knows what will happen to all of our bills. I certainly hope they all pass. But just because there are other bills on e-cigarettes does not mean my SB 24 shouldn't move forward. It is in the legislature's best interest to keep multiple options on the table. My bill will prevent kids from getting their hands on e-cigarettes, which could create an addiction for the rest of their lives. The bill will protect public health by preventing the use of e-cigarettes in bars, restaurants, hospitals, and other places. I now would like to turn to those in support, and I would respectfully ask for your aye vote.
Thank you. Anyone like to speak in support, please come forward, state your name. Welcome.
Thank you. Cindy Wilson, representing the State Board of Equalization. The board is supporting SB 24 if the bill is amended to provide adequate BOE funding for the expansion of the licensing program. Thank you.
Thank you. Anyone else in support? Opposition? We're going to limit the opposition to a total of 9 minutes.
Good afternoon, Mr. Chairman and committee. I'm Stefan Diedak, and at this point, I might actually get a second apartment in Sacramento, given that I'm spending so much time here. I'm here once again as the co-president of the Northern California chapter of SFATA, the Smoke-Free Alternatives Trade Association, and representing the Northern and Southern chapters, and it's more than 110 members. I still operate in the capacity of one of its unpaid volunteers, and I've never taken any payment from either this industry or the tobacco industry. We're very appreciative of efforts to distinguish e-cigarettes and vapor products from tobacco in parts of this bill, which is appropriate considering the well-documented harm that tobacco smoke causes. But we're concerned that in its current form, the bill will result in unintended consequences for the small businesses that make up the vapor products industry and their customers. So I'm here today with a position of oppose unless amended on SB 24. Some of the language is unclear or ambiguous. For example, while the bill provides a clear distinction between vapor products and tobacco products in some sections, it maintains provisions that designate vapor-specific businesses as a tobacco store. There are also some technical aspects, as the reference to child-proof packaging shows. The bill should instead refer to child-resistant packaging as defined by existing federal standards, in particular the Poison Prevention Packaging Act. We support and accept the proven and tested standards as it provides a uniform federal standard and believe that clarification of this will actually strengthen the bill. There's a likelihood of unintended consequences as this bill attempts to extend the Health and Safety Code's definition of electronic cigarette into a very broad definition and will cover other smokeless products, including inhalers with or without nicotine, that do not or may not produce any vapor. Future products may fit the broad definition, but likely will not fit the spirit. SVADA believes appropriate and proportional regulation is pivotal to the success of the industry. However, we're very concerned about the licensing requirements as currently reflected in the measure that we strongly oppose a licensing requirement that resembles or reflects requirements for tobacco. We're willing to engage in discussions regarding a licensing scheme that is appropriate for vapor businesses and would like to re-emphasize the overall need to be clearly distinguished from tobacco in all sections of law. None of the small businesses that make up the vapor products industry have any ties to any tobacco companies, and vapor products contain no tobacco. It would be like referring to a caffeinated soda as a coffee product. Considering that vapor products provide an alternative to smoking and are widely recognized as being safer than combustible tobacco, we would like to register our concerns about the broad statewide public use bans set forth in this bill. Those are intended for combustible tobacco and should not be wholly applied to the use of vapor products. While we're opposed to SB 24 unless it's amended to address our concerns, I'd like to make it very clear that we're solidly in favor of prohibiting sales to minors as evidenced by our industry's participation in the age verification program, and we're willing to work with the legislature on that concern. I believe we have an opportunity here to engage in conversation regarding our points of opposition and work towards a bill that we could either be neutral on or actually support, as a step in the right direction of having a statewide delineation between vapor and tobacco products. As currently drafted, however, we respectfully request that you vote no on this bill. Thank you.
Good afternoon, committee members. I'm Liz Williams with Americans for Non-Smokers' Rights. We're a national public health nonprofit based in California. While we support Senate Bill 24's intent to regulate e-cigarettes, we oppose the bill as it is currently written because it does not define e-cigarettes and other electronic smoking devices as a tobacco product, nor does it define smoking to include the use of e-cigarettes. We believe that the bill is being sponsored for all of the right reasons and that there is no harmful intent, but good definitions are critical. We are very concerned that the language in SB 24 could unintentionally support the determined efforts of e-cigarette companies, tobacco companies, and their allies like the American Legislative Exchange Council to enact industry-friendly laws that are based around defining e-cigarettes separately from tobacco products. E-cigarettes should be regulated in the same manner as tobacco. Separate definitions make it easier to exempt e-cigarettes from current or future laws that address sales, tax, or where the products can be used. SB 24 should not be inadvertently used to undermine California's tobacco control laws. When California prohibited the sale of e-cigarettes to minors in 2010, we didn't know that tobacco companies, most of which now own e-cigarette brands, and their allies like ALEC would promote the use of separate definitions as a means to limit the strength and effectiveness of tobacco control laws. As a result, some states explicitly prevent e-cigarettes from being regulated as tobacco, and some are also preemptive of local laws. In California, communities are leading the way. Nearly 140 California municipalities regulate e-cigarettes, including more than 60 that prohibit their use in smoke-free venues. These laws, by and large, treat e-cigarettes as tobacco products and as smoking. We don't want the legislature to enact language that is at odds with the strong, innovative laws that are being adopted by cities and counties. It's also important to note that the FDA announced its intention to regulate e-cigarettes as a tobacco product, and it's in the process of doing so. The fact that the FDA considers e-cigarettes to be a tobacco product is further reason that California should not treat e-cigarettes separately. We urge you to amend the bill to define e-cigarettes as a tobacco product so that we don't inadvertently create opportunities for e-cigarettes to be regulated differently than tobacco or run counter to the strong public health precedent being set by communities. Thank you.
Good afternoon, Mr. Chair and members. I'm Tim Gibbs with the American Cancer Society Cancer Action Network, and we are opposed to this legislation because it does not define e-cigarettes as a tobacco product. The 2010 definition of e-cigarettes that was referenced, we don't consider adequate any longer as the technology has gone so much further in the last 5 years. The nicotine in e-cigarettes is derived from the tobacco plant. Without tobacco plants, there would be no electronic nicotine delivery devices like e-cigarettes. Both Altria and RJ Reynolds acknowledge on their website and on their packaging that e-vapor products are tobacco products. And in 2009, Enjoy sued the federal government claiming to be a tobacco product to evade regulation. Now they are arguing precisely the opposite to, again, evade regulation. So despite the evidence, this bill does not acknowledge that e-cigarettes are tobacco, and that's why we oppose.
Lindsay Freitas with the American Lung Association in California, and as my colleague mentioned here, there are over 140 communities in California that have passed regulation to look at electronic cigarettes by and large as tobacco products. 33 of those communities are actually in cities that you all represent. Those include Oroville, Anaheim, Santa Ana, San Luis Obispo, Gilroy, El Monte, Compton, Baldwin Park, Alhambra, and Los Angeles, just to name a few. And it's really important that the regulations we pass at the state level match what's going on at the local level. So, for these reasons, the Lung Association's in opposition.
Thank you, Mr. Chair and members. My name is Kelly Hampt. I'm here on behalf of the American Heart and American Stroke Association. Regrettably, we oppose this bill. We believe the senator's intent of this bill is good. Unfortunately, we must oppose on the basis that this bill treats e-cigarettes as something other than a tobacco product. Last week, this committee passed out the gold standard in terms of e-cigarette regulation and did so knowing that the definition is important and has long-term impacts in the way California would regulate e-cigarettes and ensuring we continue to remain a leader in tobacco control. According to the CDC, from 2011 to 2013, U.S. middle and high school students who had never smoked cigarettes, but who had used an e-cigarette, tripled. More recent survey data from a Monitoring the Future report suggests an even more dramatic rate. High school students' usage in 2014 was 17% among 12th graders, higher than the use of tobacco cigarettes. The definition and the way we will regulate e-cigarettes in the future has an enormous impact on our tobacco control efforts in this state, and therefore we respectfully ask for your no vote.
Good afternoon, Mr. Chair and members. Sue White-Seum on behalf of Health Access California. We are the statewide consumer advocacy coalition on health care, and we are regrettably opposed to this measure unless it's amended to treat e-cigarettes in the same manner as other tobacco products. We believe that SB 24 threatens the decades of progress that California has made in its tobacco control and public health campaigns by treating e-cigarettes differently than other tobacco products. Recent studies show that e-cigarettes have potentially serious health consequences. In fact, the California Department of Public Health recently, in their 2015 report, found that mainstream and secondhand e-cigarettes aerosol contains at least 10 chemicals that are on California's Proposition 65 list of chemicals known to cause cancer, birth defects, or other reproductive harm. As a result, the department recommended that existing laws that currently protect minors and the general public from traditional tobacco products should be extended to cover e-cigarettes. For these reasons, we are opposed unless amended, as previously mentioned.
Thank you. Anyone else in opposition? Seeing none. Oh. Getting your exercise in for the day.
Yeah, sorry. Michelle Cabrera with SEIU California, also in opposition.
Thank you. Anyone else? Just please state your name and position only.
Hi, Kara Leffler from Lincoln, California, and as this bill is written right now, I oppose it.
Thank you.
Jeff Braithwaite, owner of Tasty Vapor in Oakland, California, also co-president NorCal chapter of SFATA, and I'm opposed this bill unless amended.
Danielle Bloss, resident of Oakland, California, and a vapor. I'm opposed unless amended.
Josh Jones, I'm also a vapor. I'm opposed unless amended.
My name is John Kavanaugh. I'm an owner in Costa Mesa. I oppose this amendment unless amended.
My name is Patrick Knowles. I'm a 8th generation Californian, small business owner, taxpayer, and I oppose this bill unless amended.
Austin Hopper, president of Cutwood LLC and Vaping Industries, Distribution and Wholesale. And I'm also the political action chairperson for SFATA Southern California, and I oppose this bill unless amended.
My name is Aaron Peterson. I own an e-liquid company based out of Newport Beach. We employ over 40 Californians, and I'm opposed to this bill unless amended. Thank you.
Eric Beal from Santa Rosa, California, opposed to this bill unless amended.
Tyler Frost, Valley Springs, California, opposed unless amended.
My name's Katie Dunn. I am the manager of a vapor store. I'm also part of the Vaping Education Council, and I oppose this bill.
My name is Carrie Hess. My husband and I own NorCal Vape in Redding, California, and I'm here to represent my 3,000 customers in opposition to this bill unless amended.
Corey Baravano, the Vapor Spot, opposed unless amended.
Angel DeLeo, the Vapor Spot, and the Vaping Education Council in opposition unless amended.
Edward Wolf, please talk to treating physicians and neutral, hoping for pragmatic amendments.
Thank you. Any questions, comments from any of the members? Senator Roth.
Thank you, Mr. Chair. I'm concerned about the tobacco product definitional issue, Mr. Chair, but I think in order to allow the debate to continue on this bill and other legislation pending in this House and the other House, I'll be supporting the measure. Thank you.
Thank you. Anyone else? Comments, questions? Senator Nguyen. Senator Nguyen.
Senator Hill, we spoke a little bit ago. I just want to ask if you've had an answer for whether this would involve, if you had one store versus one company, multiple stores, how many times do they have to license with the BOE?
Yes.